It's been very clear to me over the years that I've been doing this that these people that push alternative treatments have a fixation on the immune system. And the immune system, as you may or may well know, is quite a good system we have on our bodies. But the alternative therapy crowd have this obsession with the immune system, to a point where on my GMAF video there's a guy, basically the way he's coming across, it's like he thinks you can boost your immune system from 60 to 100. And you look at the language when they talk about the immune system, when they're talking like treatments like the Gerson therapy, they go, oh, we can it increases your immune system. And I'm just like, you can't increase your immune system. You can make it stronger by having vaccines and, but you can't go from like 0 to 100 with your immune system. And then it also comes down to genetics as well. Look at nurses. You take nurses and they have the strongest immune system of anyone, because they are constantly coming into contact with sick people. Hence their immune system, because they're constantly coming into contact with it, is a lot stronger. Notice I'm saying stronger, not improved or increased, because that's what these people have. They have this absolute obsession with it. And you've got to look at what a lot of these are coming down to, like GMAF. According to, the GMAF, it's a naturally occurring thing in your body. Right, okay, good, but it goes back to natural is best, but it's not really. Anyway, that's off topic, but never mind. They're basically saying, look, this activates your white blood cells again to get rid of cancer. Except, considering we already have this stuff in our bodies, if that were the case, we'd be saying, what cancer? What is this thing you call cancer? You've only got to look at, Cancer Research UK that have pages and pages and pages. Or just look up immunotherapy, which is, the next big step forward in cancer treatment. There is a ton of stuff coming out for it. Not only that, but you have a vaccine coming out of Cuba, which is highly effective. I think it's breast cancer, I think it is. And that's going to be huge. You've got there are other vaccines for cancers that are now being, developed and being in trial. You've got, you actually have, GMAF is actually going for a proper scientific study, right? And I must stress this, it's early stages and they are recruiting people at the moment for this test. It is not being done, it is not being carried out, as some people are claiming that it has been. It hasn't. So, yes, the immune system can be used to fight cancer, but the way and the science that is being used is because when cancer is actually, in your body, it turns off the receptors for the white blood cells to be able to attack it. And a lot of the science that is being put into this stuff is all about returning on those receptors so that, the body can get rid of it. There's one where, where they think, heat treatment, where they can, they can sort of stick it into the ball and just burn it so it becomes scar tissue. So then the body recognises it and then, will come back to it. And there's actual, I keep on saying it, but there's actual science involved in this stuff. When you look at all of these, alternative therapies, oh, it just improves, it improves your immune system, increases your immune system. It'll be fine. And they've got this stupid fixation on it, and it's just like, if your treatment actually worked, science would not ignore it. That is the truth. Science would not ignore something that worked and got results. And doesn't matter, from all these alternative therapies throughout the years, not a single one has gotten results or has been proven to work in a lab setting or in an actual scientific experiment. Once again, these people are failing so badly, and their obsession on something that, again, me myself, I am not a scientist. The furthest my scientific knowledge has gone has been to a GCSE level. I got a B in my science. I got a double B because it was a double award in my science. So here's me, who has that, who can easily recognise when these people are talking bullshit, and yet hundreds of people are getting conned or are falling for the ridiculous marketing that these people put out. It is insane. I can't believe it half the time, what these people claim and then are not challenged on, or just walk away. I saw a thing on YouTube, a group of people discussing it, and I'm just like, I would love to get in on that discussion. And I've sent an email to the guy. I'd love to be on your next discussion you have about health. I don't know if they'll have me on, but I'd love to be on, purely to actually one-on-one, engage these people, and try and get to the bottom of what it is about this, because most of it does come back to this ridiculous conspiracy theory of Big Pharma is out to make money, and it's just like, it's so ridiculous, so ridiculous.